Well, to answer this question, I would like to look into one of our recent case that I treat. Is a very famous footballer in Malaysia who was actually affected by an acid burn. This footballer actually came to us and we treated the patient from the beginning until the end. And he is back to his playing level now at the professional football. So when we talk about burn injuries, we always look into all these aspects such as what is the area that is affected, how bad is the initial injury, and also the result from the initial injury. Also, we do not forget about the psychological aspect of the injury. Sometimes burn injury, they have what we call as post-traumatic stress disorder, where they become very stressful and they may have depression, and also the support of the family members. And last but not least, of course, in the financial aspect of the treatment, because this type of injuries usually carries a lot of materials, numbers of surgeries, as well as rehabilitation process that can be quite costly. So when we look into all this, we put it in a place together, then we can formulate the plan to treat the patients. So in terms of the treatment for the patient, again, you have to look whether it's actually only the cosmetic part of it or also the functional part of it, but most of the time both will be affected. And how we formulate the plan will be according to each patient's severity of injury. For the recovery process, it depends on the extent of injuries. The patient comes with a very mild type of injuries, maybe burn from just hot water. So the recovery will take probably about less than a week. In contrast to a case where injury can be very severe and the recovery may take up to a few years. But then again, at these current times when we are living, we have a lot of modern dressings, modern techniques, and how we do things are different from maybe how we did 10 to 20 years ago. In the forms of recovery process become very fast, and also the resultant scar also become very minimal. So in fact, when we treat the patient in our center, we have quite an advanced facilities and technicalities that we use to treat the scars. So this ranges from laser treatment to our serum and growth factor as well as stem cell treatment. So when we put all this in together, when instead of looking at few months or years, we can actually hasten the process up to a few weeks, even for major burns.